we will discuss relation related with the blood vessels. So the artery, here you can see this is the heart, and this is the largest artery of the body. The largest artery, it is the aorta. Artery carries the oxygenated blood from away from the heart, means it carries the it pumps the blood from the heart to the different part of the body, and it carries the oxygenated blood. Mainly the two exceptions, pulmonary artery and umbilical artery, which carries the deoxygenated blood. So arteries, it is resemble the tree because they have branches. Here you can see this is the largest artery and it gives the branches. So it resembles like a tree, trunk and the branches, and then it goes to the small branches and ultimately leaves. So that's why here the artery, which is the larger artery, then it gives the branches. This artery further it gives the branches, and this artery further it divided. So it is the like a tree in patterns. While the vein which carries the deoxygenated blood, here I will show you, this is the vein. Here you can see this is the superior vena cava, and here this is the inferior vena cava, which is open. So vein which carries the deoxygenated blood towards the heart, and with the exception of the pulmonary and umbilical vein which carries the oxygenated blood, it resembles the river because they have a tributaries. So whenever we explain the vein, it is like a resemble like a river, and it have no branches, but it drains the blood. That's why it is called the tributaries. I will show you one small vein. This is the skin. I have reflected it. It is a more superficial structure. Deep to the vein, there is a fatty tissue. These are the fatty tissue, and inside the fatty tissue, here you can see this is the one of the vein of the upper limb. It is a cephalic vein. So this cephalic vein, which carries the blood from the upper limb, one of the vein. There are many veins inside the upper limb, but this vein which carries the blood from the upper limb, and it is open inside the large vein. Here you can see this is the vein. It is called the Subclavian Vein. So vein which carries the blood from the different part of the body, and it open inside the large vein, and then large vein ultimately open inside. It makes a superior vena cava. It makes the superior vena cava and inferior vena cava, as well as the vein which receives from the lung. It is called the pulmonary veins. Here you can see these are the cephalic vein, which is a very small tributaries. Here you can see these are the tributaries of the cephalic vein, and there is another term which is called the capillaries. You cannot see the capillaries by your naked eye. It is the network of microscopic vessels which is connecting the vein and arteries. Both are connecting venue. It is the actual site which is present throughout the body. It is everywhere which is the capillary which is present, even in skin, superficial fascia, fatty layer, deep fascia, muscles, everywhere inside the body there is a presence of capillary, except some places like which is absent, there is a capillaries, mainly the cartilage which is not received the blood. So the capillaries are the microscopic vessels which is connecting arterioles and venules, and it is the actual site where there is a exchange of the material, mainly the carbon dioxide and oxygens. Anastomosis, it is the precapillary and postcapillary communications between the neighboring vessel. It is called the anastomosis. Here you can see this is the diagram. This is the arterial end, and this is the venule ends, and this is the network of capillaries. It is a microscopic structure, and it is the actual where there is a exchange of the materials which is happen, mainly the nutrition as well as carbon dioxide and oxygen which is exchanged. And some whenever there is a not required, there is a directly arterioles which is connecting to the venules by the through fair channels. And the capillaries are the two types. One is the inside the capillaries there is a hole, it is called the fenestrated capillaries, and without hole inside the capillaries it is called the continuous capillaries. The linear elevation, the term used for the describing the bony features. The elevation, it may be linear elevation. It means there is a elevated part which is like a line. Here I will show you. This is the femur. It is the elevated area. This is called the linea aspera. I will another line here. You can see this is the one line. It is called the between the two elevated area. This is a greater trochanter and this is a lesser trochanter. And in between there is a line. It is called the linea aspera. Intertrochanteric line. This is the behind there is a it is the elevated area. It is called the intertrochanteric crest. So the any elevated part inside the bone, it may be some place it is explained as a line, some place which is explained as a lip, ridge, crest. Here you can see this is the hip bone and this elevated area, it is called the iliac crest. I will here you can see this is the elevated area of the line like structure. It is called the iliac trace. So different places the term which is elevated area and it is the line, it is called the linea. The sharp elevated area, here you can see it may be spine, it may be styloid process, it may be cornu, or it may be humulus. Here you can see this is the spine of the vertebra. These are the transverse process of the vertebra. Here I will show you over the mandible. This is the cornu. This is the elevated area. It is called the coracoid process. Or inside the skull, it is the elevated area. Here it is called the humulus. Here you can see there is a this is the humulus. So sharp elevated area, it is like a elevated area from the bone. It may be mentioned as a spine, it may be mentioned as a process, it may be mentioned as a cornu, or it may be mentioned as a humulus. So different places the name which is given differently. Rounded or irregular elevated area, here the inside the femur, the large elevated area, it is called the greater trochanter. Small, it is called the lesser trochanter. If I will over the humerus, here there is a large elevated area, it is called the greater tubercle. The small elevated area, it is called the tubercle. This is the condyle. Here you can see this is a large elevated area. It is the medial condyle, lateral condyles. Here you can see this is the epicondyle. These are the two medial epicondyle, lateral epicondyle. It may be malleolus or trochanter. Here you can see this is the tibia and this elevated area on the medial aspect of the tibia. It is called the medial malleolus. And if it is another bone on the lateral side, elevated area, it is called the lateral malleolus. So these are the rounded or irregular elevated part inside the bone. Different way we will explain, like a tubercle, it may be tuberosity, it may be epicondyle, it may be malleolus, or it may be trochanter. So these are the words which is used in different bones, have a different name which is given into the elevated area. A ramus is the broad arm or process projecting from the main part of the body of the bone. It is called the ramus of the bone. Here this is the mandible, this is the anteriorly, this it is called the body, and this projecting part, it is called the ramus. It is the broad arm or process projecting from the main body part. It is called the ramus. So here this is the ramus of the mandible, and a ramus of the mandible have a further part, coronoid process. This is the condylar process, or it is also called the head of the mandible. Depression, the term used for describing in bony feature depression, it may be very small, like a head of the pin. Like depression, it is called the pits. It may be called the impression. It may be called the fovea. Some places it is called the fossa. Some places it is called the groove. Some places it is called the notch. So I will show you some depressive area inside the bone. Very small, like this kind of the depression, it is called the pit, and larger than it there is a fossa. This is the mandibular fossa, where there is a head of the mandibles which is attached. Here you can see this head of the mandible. I will keep into the anatomical positions. So the this is a mandibular fossa. So wherever there is a groove part, it is called the, either it is called the fossa, fovea, or it may be groove. Here you can see this is the auditory sulcus. So this is also groove where it lies the auditory tube. So it is called the sulcus. Some places there is a depressed area. This is the head inside the mandible. This is the depressed area. It is called the fovea. And some places this is the depressed area into the between the coronoid process and condylar process. This area it is called the notch. It is called the mandibular notch, or and it passes the mesenteric nerve. So depression of the area, it may be called as a pit, it may be called as a fovea, it may be called the fossa, it may be called the groove, sulcus, or it may be called the notch. Opening, maybe it is called by the foramen canal hiatus. Here you can see mainly the foramen you can see inside the skull. This is the foramen magnum. This is the foramen oval. This is the foramen spinosum. This is the jugular foramen. Some places there is a small canal. Here you can see this is the hypoglossal canal. This is the where there is hypoglossal nerve which is passes. Some places it is explained as a hiatus, and some place it is called the aqueduct. So wherever there is an opening, it may be considered as a foramen, it may be considered as a canal, it may be considered as a hiatus, or it may be considered as a aqueduct. So different places there is a different name which is given for the opening. A cavity, a large cavity within the bone, it is called the sinus or cell, or it is called the antrum. Here I will show you, this is the bone. This is our upper jaw, and inside there is a upper teeth. And just above to it, this is called the maxillary bone, and inside there is a hollow. This bone, it is hollow, and that's why our skull, which is light due to the some spaces inside the bone, and this spaces inside the bone, it is called the sinus. Here inside the maxillary bone, there is a space, it is called the maxillary air sinus. Here there is a frontal bone, and there is a space inside the bone, it is the frontal air sinus. Inside the nose middle part, there is a ethmoidal air sinus, and here there is a, inside the sphenoidal bone, there is a space, it is called the sphenoidal air sinus. Some places it is called the cell or antrum. Here inside the mastoid process, it is there is a presence of the cell, it is called the mastoid air cells, and adductus to antrum. Smooth articular area, it may be facet, or it may be condyle, head, capitulum, or trochlea. I will show you smooth articular area. Here you can see this is a this is called the trochlea. It is like a pulley. This is called the capitulum, and mostly this articulating area which is attached with the head of the ulna. Here you can see this is a ulna which is attached with it, and there is a some bones, there is a condyle here. This is the smooth articulated facet inside the femur. This is the medial condyle. This is the lateral condyle. This one is the head of the femur, and so smooth articulate area may be explained as a facet. It may be some bone it is explained as a condyle, some place it is mentioned as a head, capitulum, and trochlea. Inside the head of the humerus there is a depressed area, it is called the fovea. This is the, you can see inside the head of the femur, here there is a one ligament which is attached, it is the ligament of the teres. So this is the attachment of the ligamentum teres femoris. So different places there is a different name which is given. Inside the skull there is a bones which are united, it is called the sutures. Here you can see this is the temporal bone and this is the above one is the parietal bone. So it is the temporo-parietal sutures and it is a squamous type of the sutures. This is the occipital bone and two parietal bone are united, it is called the Lambroid Sutures. Here it is the continuous, this is the Lambroid Sutures. So when there is a inside the skull there is a bone are united, two different bone are united, it is called the sutures. Here you can see this is the elevated area of the scapula, it is the shoulder bone. This it is called the spine of the scapula. So elevated area we already mentioned, it is either it is called the spine, either it is called the it is, if it is blunt then it is the trochanter, tubercle or head of the this kind of the words which is used for the elevated area. Here you can see this is the space inside the frontal bone, it is called the frontal air sinus. The space which is lies here inside the frontal bone. The space inside the sphenoidal bone, it is into the midline, it is the sphenoidal air sinus on the both sides. If there is a space inside the maxillary bone, it is the maxillary air sinus. Here you can see this is a maxillary air sinus. Mainly this sinus which is involved during the sinusitis, means inflammations of the sinus, mainly during the cough. There is a collection cough which is collected inside this sinus and it is very difficult to drain and it leads to there is a chronic pain inside the head. These are the small sinuses, ethmoidal air sinuses are 2 to 3 number inside the nose, inner side of the nose. So this is about to the sinus. Here inside the radius there is a elevated area, it is called the radial tuberosity. So different places there is a, here inside the ribs there is a elevated area, it is the tubercle. Here you can see this is a tubercle of the ribs and this is the head of the ribs. So elevated area, it may be tubercle, trochanter, it may be tuberosity, it may be explained as a condyle. Different places there is a different word which is used. Hope you enjoy the understand the terminology regarding the arteries and veins and also terminology regarding the bonds you can understand. Hope enjoy your lecture. Thank you very much.